The growing acceptance and legalization of marijuana have contributed to a widespread belief that the drug is safe for regular use. However, emerging research suggests that this perception may be dangerously misleading. Two large-scale studies have uncovered alarming connections between cannabis use and a significant increase in heart attack risk, particularly among young and otherwise healthy individuals. The findings reveal that marijuana users under the age of 50 face up to 6 times the risk of suffering a heart attack compared to non-users, alongside heightened risks of stroke, heart failure, and even cardiovascular death. These statistics present a deeply concerning picture, especially as cannabis use continues to rise in the United States and beyond. One of the most shocking aspects of the research is how quickly cannabis appears to impact heart health. The data suggests that the risk of a heart attack peaks just 1 hour after consumption, meaning that even occasional users could unknowingly put themselves in immediate danger. Despite these risks, there is little public awareness of marijuana's potential to harm the cardiovascular system. Many assume that because it is legal in various states, it must be relatively harmless. But much like cigarettes, the fact that a substance is legal does not mean it is safe. Smoking cannabis may cause damage in ways similar to tobacco, and the long-term effects on the heart are still not fully understood. The mechanisms behind these cardiovascular risks remain an area of active investigation, but researchers have proposed several troubling possibilities. Marijuana may interfere with heart rhythm regulation, increasing the likelihood of arrhythmias that can lead to sudden cardiac events. It may also heighten the heart's oxygen demand while simultaneously restricting blood flow, creating a dangerous mismatch that can trigger heart attacks. Additionally, cannabis appears to contribute to endothelial dysfunction, making it harder for blood vessels to expand and contract properly, further disrupting circulation. These effects combined suggest that cannabis use, particularly when smoked, places undue strain on the cardiovascular system. What makes these findings even more alarming is that the studies focused on individuals with no pre-existing heart conditions. Participants had normal blood pressure, healthy cholesterol levels, and no history of tobacco use or diabetes, yet they still faced significantly elevated risks of cardiovascular events. This suggests that even those who consider themselves young and fit are not immune to the dangers of marijuana use. For those who already have underlying health conditions, the risks could be even more severe. Despite the overwhelming evidence pointing to a strong correlation between cannabis use and heart disease, there is still a lack of awareness and policy intervention regarding these dangers. Physicians are now calling for routine screening of cannabis use during medical assessments, much like they do for tobacco and alcohol. However, many patients may not even consider their cannabis consumption relevant to their health, leading to underreporting and missed opportunities for prevention. Without widespread education on the risks, more individuals will unknowingly continue to expose themselves to life-threatening cardiovascular complications. The research also raises concerns about whether current public health messaging is failing to keep up with the reality of cannabis-related dangers. Decades of anti-smoking campaigns have successfully educated people on the risks of tobacco use, yet no similar effort has been made to highlight the cardiovascular risks of cannabis. As marijuana becomes more socially accepted and legally accessible, there is a risk that users will continue to underestimate the potential harm, leading to an increase in preventable heart attacks and strokes. The legalization of cannabis should not come at the expense of public health, and without proper warnings, more individuals may suffer the consequences of an uninformed choice. Compounding the issue is the fact that these studies were retrospective in nature, meaning they relied on past data rather than controlled experiments. While the results strongly indicate a link between marijuana use and heart disease, more research is needed to fully understand the extent of the risk. However, waiting for definitive proof before taking action could come at a significant human cost. Policymakers, healthcare providers, and public health officials must take these warnings seriously and work to educate the public on the hidden dangers of cannabis use. Ultimately, the evidence is clear. Marijuana use is not as harmless as many believe. The risk of heart attacks, strokes, and cardiovascular death is real, immediate, and potentially severe. As cannabis use continues to rise, particularly among younger populations, it is crucial that users understand the true risks they face. Without urgent action to raise awareness and implement appropriate health warnings, the growing public health crisis linked to cannabis use may spiral out of control, leading to countless preventable deaths.